The debate over breast cancer treatment and diagnosis is intensifying today. Some patients in their early stages are choosing to watch and wait instead of rushing and treating their cancer.
Teri Okita sat down with a doctor pushing the controversial approach to treating breast cancer.
After a routine mammogram 3 years ago, 52-year-old Barbara Mann was diagnosed with ductal carcinoma in situ, the earliest form of breast cancer.
The initial reaction was, get this out of my system.
DCIS accounts for up to 25% of all screen-detected breast cancers. Mastectomies or lumpectomies have become standard treatments.
How are you?
Surgeon Laura Esserman is considered a pioneer of the active surveillance or watchful waiting treatment for breast cancer. She monitors patients with low-grade DCIS with screenings and medication for 6 months without surgery.
Part of the personalization of medicine in breast cancer is not just to do more for those who need it, but to do less for those that don't.
If DCIS shows little or no growth, patients can avoid more aggressive treatment, which has worked so far for Barbara.
It just was an immense relief.
A study of more than 100,000 women with DCIS found aggressive treatments do not reduce breast cancer mortality rates.
When time is not of the essence, when it's not an emergency, you can offer different options and you can give people a chance to kind of get a better sense for, well, how is my tumor behaving?
But studies suggest that about 1/3 and possibly more of DCIS cases will progress to invasive cancer if left untreated. The challenge is pinpointing which types of DCIS are most likely to worsen. Kristen Orantia's mother died from breast cancer. The 42-year-old knew she was at high risk when she was diagnosed with DCIS last June. She chose a double mastectomy.
I don't have to go in for this every 6-month active surveillance and have the worry and the anxiety and the stress of, am I going to end up like my mom?
Dr. Esserman's approach is controversial, but she hopes it will lead cancer treatment into a better future.
And Teri Okita joins us from Los Angeles. Teri, nice to see you. Can you explain to us what DCIS is exactly?
Right, so DCIS stands for ductal carcinoma in situ. It's pretty common. About 50 to 60,000 Americans are diagnosed with DCIS every year, and it's basically found when there are abnormal cells in the lining of the milk duct. It's often referred to as stage 0 breast cancer, but like many conditions and diseases, it comes in different types. So some can be slow growing and indolent, and some can be more aggressive and become invasive. So what this team of doctors at the University of California in San Francisco at the breast care center there are trying to do is identify the patients who have this less invasive type of DCIS and see if maybe we can take a step back and not throw the entire kitchen sink of treatments at this breast cancer and see if the active surveillance approach can work for these women.
Teri, on that point, the doctor you interviewed said she's seen the devastating effects of treatment. So what sort of problems persist for women who do aggressively treat DCIS?
Sure, and Dr. Esserman has often said, you know, she gets a lot of women that say, what's wrong with overtreatment? I just want to get this out of me. That's kind of the common response for a lot of patients. But she says that with standard therapies like mastectomies, lumpectomies with radiology, radiation, a lot of side effects can occur, like chronic pain, like after mastectomies, or the emotional toll that it often takes with patients and their families as well when they've had lumpectomies or mastectomies. So she's saying, you know, again, maybe let's take a step back, and while there, in some cases, breast cancer should be treated aggressively for some, maybe some women need it less.
Is that basically how they're advising the women unsure of whether to treat or monitor the DCIS?
Well, again, the key is always talk to your doctor. Like, you always hear that, and that's very true, because one size does not fit all for breast cancer treatment. And the two women that I spoke with they were both diagnosed with DCIS, and they had very, very different opinions about how to be treated, different thoughts about it. And so while one was very aggressive because she had a family history of it. The other didn't have any family history, and she did go with the active surveillance method, and she thought maybe that would work best for her. So again, talk to your doctor. That's the best way to see what approach and treatment is best for you.
Teri, I know you have another piece coming up. What can you tell us about part 2?
I do. This next piece is about post-mastectomy bras. Because a lot of women, this is sort of news you can use, because a lot of women, once they go to recovery, they don't have the wide selection of bras for the particular stage of development or evolution that they have after recovery. So we take a look at what the best kind of bras are, the most comfortable bras for what stage you are in recovery, and also that they don't have to be matronly and dowdy, because a lot of women have to deal with that emotional toll of not feeling feminine or sexy anymore. So we take a look at the wide range of post-mastectomy bras.
All right, Teri Okita from Los Angeles for us. Thank you.